Okay, here's my baby. I'm gonna do my assessment.
Good girl. Okay.
So,
Record you? Or can you get her? Oh.
wait, go. Like record me doing it on her.
Okay, ready?
It's already recording.
Oh, it's recording? Okay. Okay.
Okay. So I come in the room.
Mm-hmm.
I wash my hands. No.
Mm-hmm.
Oh, no. Stop.
Hey, Mbenga, stay. Stay.
Okay. I
Good.
wash my hands, I clean my stethoscope, and then ID the baby with the mom. I'll just say I ID'd her. Okay. And then I'm gonna go ahead and start with the head. I need to line her back though. Come on. Stop. So I'm looking at the head. I'm looking for caput. Maybe cephalohematoma. Molding. Interior fontanelle. Hey. Anterior fontanelle. And then the suture. And then the posterior fontanelle. Looking if they have any hair. My baby's not being cooperative.
Leaves all the towels.
Oh, okay, I'll really.
I remember when I did it on her last time.
Good girl.
There you go.
Okay, and then now I'm gonna go ahead and look at the ears, see if they're level with the eyes, see if the penis is formed. Looking for recoil. This baby has no recoil. Okay. Looking at the face, it's symmetrical. Looking at the eyes, looking at the sclera, any discharge, any swelling in the eyes. Now looking at the nose, if it's midline, and if the nares are patent. Now I'm going to check the rooting reflex. I'll rub her cheek. She doesn't have a rooting reflex. I put gloves on, and I'm going to check the mouth. And I'm looking at the lips to see if there's moisture or the color. I'm going to have open her mouth. And I'm going to feel around the mouth to see if there's any cleft palate. Looking at the membranes inside. Looking at the tongue if it's midline or if it's protruding. And then I go the neck. And I look if it's midline. Am I missing anything?
Oh, wait, neck? Oh, yeah.
Midline. Anything else? I'm missing something.
Clavicles.
Is that the only thing?
Webbing.
The neck?
Webbing. Oh.
I don't know what webbing is. What's the next one?
The clavicles intact.
Okay. Checking the clavicles. If the clavicles are intact. Now I'm looking. Oh. I have to make sure the rest of the body is warm. Looking at the chest. Make sure there's symmetry. Feeling any breast buds. If you feel breast buds, that's normal. Preterm babies, they don't have any breast buds, I think. Nipples. Anything else?
Retractions?
Oh, see if there's any retraction while the baby's breathing. I don't see any retractions.
Okay, lung sound?
Not my... I'll pretend.
Let's pretend.
Okay, so I'm listening to breath sounds. 1, 2, midline 1, 2, and then the side. 1, 2. Breath sounds are clear. And then the heart rate. Do you remember the heart rate? Did you listen to all the valves or just the apical?
This is, the apical.
Okay, so let's listen for the apical pulse for a minute. Anything else in the chest? No?
That's it.
Feel the brachial artery. Looking at the extremities if they're symmetrical. At the same time looking at how many fingers they have. Say the baby has 5 fingers on each hand. Testing the grasp reflex. And then checking the square window. Which, oh, it's like this. Square window. And then the scarfing. What else am I missing? I think that's it. Looking at the abdomen.
Did you check the cord?
No, not the abdomen yet.
Oh, okay.
So now at the abdomen, I'll look at the cord now then. Looking at the cord, looking for the vessels. What am I looking at the cord? Vessels? What else?
Stump.
Stump? What does that mean?
Just like if it's clamp or is it dry.
Oh, if it's moist, if it's red.
Mm-hmm.
Okay. And then looking if it's like the shape of the stomach. Anything else?
That's it.
Oh, bowel sounds. Listen to bowel sounds.
Oh, yeah, sorry.
Listen to bowel sounds. I can ask the mom when the baby last pooped
Mm-hmm.
or urinated. Okay. Then I'll cover this top part. And I'll go to the bottom. And I'll look at the genitalia.
Mm-hmm.
If it's a male, I want to look for rugae, which is a sign of term on the scrotum. If we're girls, the majora should be over the minora.
Mm-hmm.
Check if the anus is patent. I'll go on. Anus is patent. Okay. And checking the legs, if they're symmetrical. Check 5 toes on each foot. Looking for any creases on the foot. If there's no creases, it would be preterm. While I'm at the feet, I'm going to go ahead and check the plantar reflex. So I just push against the foot and it should curl up. And the Babinski, go up and across. And then the hip one, that one I don't know. I have to look it up.
Yeah.
The one was to push up.
Yeah.
And then push up and out.
Yeah. Ortolani's and...
Ortolani's and Barlow.
Yeah. Mm-hmm.
Okay. And then I'll cover that now. I can check for another reflex, the tonic neck, if I turn this way. Let's turn this way. If I turn this way, they should do the fencing move, which is like this. I'll go ahead and turn them on their back.
Doesn't like that.
The babies don't like it?
No, Mbenga
Oh,
doesn't
they
like it.
Okay. I'm looking at the back now. Looking at the spinal cord is aligned and intact. Any dimple at the bottom or hair tuft. Looking at the skin, looking for... I don't know how to say the words.
Oops. The back?
Like the skin stuff.
Oh.
Mongolian spots.
Oh.
I don't have to practice the
Like telangiectatic nevi and stuff? Isn't that somewhere else though? Oh, I forgot.
Oh, it could be anywhere.
Oh.
Let's look over the skin.
Caffeole, Nevus flammeus, Erythema toxicum,
I think that's it.
vasculosis.
That's all I got.
What was your gestational ages again that you said?
The ear. Gestational age was checking the air recoil. The scarf window, not scarf window, the square window, which is the hand thing. Scarf was the one where you put across the chest. And then the rugae, or the female, the majora, minora. And then the creases on the foot. Anything else?
I think you're done.
I think that's it.
Yeah.
Okay.
Stop.
Yep.
Bye, Mbenga.